Welcome everyone to today's Legal One webinar on navigating vaccine and face mask mandates, quarantine, public health guidance, and reopening. We appreciate you taking time from what we know is an incredibly busy schedule as you all prepare for school reopening to be with us to talk about these important issues. My name is David Nash. I'm the director of our Legal One program. And of course, we at Legal One have been doing all that we can to support you as we've all struggled to work through this pandemic and to understand what we can do to support our students, our staff, each other, as we're preparing for reopening. Very happy to have with me today two wonderful guests who are going to help us as we think about issues related to public health and reopening. So Dr. Wayne Yankus has been just an incredible support for us as we are thinking about these issues. He is a longtime school physician, previously had served as president of the New Jersey chapter of the American Academy of Pediatrics, and he has been a real leader in the state of New Jersey on addressing these issues. So Dr. Yankus, thank you as always for being with us.
You're welcome. Glad to be here.
We also have with us, as we have for just about all of our webinars, Rebecca Gold. Rebecca is a consultant with us at Legal One, is now also working with us at the New Jersey Principals and Supervisors Association as Assistant Director of Retirement Services, and for many years has been a very experienced HR director in multiple school districts, in addition to lots of other roles that you've had over the years, Rebecca. So thank you so much for being with us.
A pleasure, thank you.
So as we walk through these issues today, and of course, you all know this, that there have been so many developments in just the last week or so. But as we walk through these issues, we're trying to give you the latest information. Of course, we're not giving you legal advice on how to handle any particular matter. I will add, and Dr. Yankus would agree with this, we're not giving you medical advice on handling any particular situation, but we are trying to give you the best available information. So as we go throughout the webinar today, we do encourage you to type in questions. Rebecca Gold will be monitoring that feature and will let us know along the way if we have any questions, and we'll do our best to address all the questions that you raise. So in our short time today, we're going to try to cover a lot of ground. We're going to talk about some, as we said, some important new developments, and they're coming fast and furious. We'll talk about the governor's executive order impacting vaccination and masking and related health protocols. We'll get into some more detail about issues of masking and some of the things that we need to understand and be prepared for. Issues of vaccination as well. Some of the challenges that could come up when it comes to testing and trying to put in place systems so that we can do the testing that we need to do on a number of fronts. Dealing with challenges related to either staff or students and families who may choose to travel, believing that now we can travel freely whether you're vaccinated or not, which is not accurate. And we want folks to understand what the CDC and the New Jersey Department of Health are still saying about travel, in particular for unvaccinated individuals and appropriate quarantine times. We will walk through a number of issues related to quarantine, including the Department of Education guidance that just came out recently regarding virtual instruction. We'll walk through some related issues related to contact tracing. Some practical logistical challenges for schools with things like providing food in the school building. And throughout, we'll talk about what we know, unfortunately, is likely to happen in at least some of your communities, that there may be some resistance to some of the protocols and requirements that we're talking about, and making sure that you're prepared for that and able to effectively address those issues. So as far as what's new, this is just what's been happening in the last couple of days. We at the New Jersey Principals and Supervisors Association, through our legal department, our government relations department, and us here at Legal One, we work together to put out a frequently asked questions document that we've put onto our website. We're going to walk through a number of those issues today, but not every single one. And we will, of course, continue to update this FAQ document because we know there are new issues coming our way all the time. So we want to just bring that to your attention, that we do have that document to help you understand issues related to public health and reopening. There's many other new pieces that have just come out today. The New Jersey Department of Health put out a screening testing toolkit to help school districts better understand the options that are available to them regarding screening testing, to better understand how to participate if districts choose to in one of those options, and to walk through some key steps. On September 1st, the Department of Education updated the road forward, which lays out the public health guidelines for school districts related to reopening. That document had been put out a little bit earlier in August and was just updated yesterday. Way back on August 31st, the New Jersey Department of Health put out recommendations for K through 12 schools. The day before that, on August 30th, some recommendations for screening. The governor's order, which now seems like an eternity ago, back on August 23rd, of course, we'll walk through as well. So, Dr. Yankus, one of the concerns, of course, as we're talking about this, is that we have to think about where we are with COVID. Just looking at this particular chart, you can see that we have had multiple waves in New Jersey where the number of cases have gone up. And we are seeing one of those waves happening again right now. Can you talk a little bit about the current trends that we're seeing as far as COVID positive cases and where those cases are coming from?
Sure. What this graph shows is what we all know about viruses. That is to say, viruses live to mutate, and they mutate to live. So as soon as we get one variant, there will be another variant. And we're currently living with the Delta variant, which is much more infectious to people than the original SARS-CoV-2 virus that broke out in January in 2019. So what we know is that we have been tracking for 2 years each New Jersey county's CLIA, or the infectivity rate, and we know right now, as we approach Labor Day weekend, that Monmouth and Ocean counties are high infectivity. These are the shore counties. These are people that will be coming back to our schools and elsewhere in New Jersey, which is currently otherwise in a moderate infectious zone. So what we need to remember is that this pandemic will not end just because we say January 1st. It will end when we have herd immunity through vaccination, or we have vaccines that continue to fight the variants that come about. But right now, we are seeing an increase in county cases and younger people being infected, as well as we're seeing asymptomatic vaccinated people who are still also spreading the virus, but fortunately not becoming ill enough to be hospitalized. So we're in a precarious position as schools open for the new year.
And of course, that means that the public health protocols that school districts need to put in place are really critical, so that we are doing our part to try to make sure that we're reducing the risk for everyone involved in our schools. So the governor has put out a new executive order 253. And that executive order mandates that all school employees either be fully vaccinated by October 18th or undergo regular testing. And the executive order talks about at least once or twice weekly having testing for those employees. And just to stress what we mean by fully vaccinated, that means that you are 2 weeks past having received the last dose of that particular vaccine. So for the Pfizer and Moderna vaccines, it would be 2 weeks after your second dose. For the J&J, it would be 2 weeks after the 1 dose. And that means, just doing the math, that you actually need to have received your final dose no later than October 4th to be in compliance with this requirement. So it's important that everybody understand that. It's not as if you have until October 18th to get your last shot to be in compliance with this requirement. The executive order also clarifies, because there was some confusion over this, that the mask requirement put in place for everyone in school, and of course including our students, that the exemption for medical reasons to that mask requirement requires medical documentation, not simply a note from a parent. And we'll talk in more detail about what that medical documentation should look like. But just as an initial point, a parent simply saying their child needs to have this medical exemption is not sufficient. And no school district should be accepting that as the sole basis for granting such an exception. The governor also did say, and some folks haven't understood this, but it's important to stress that a school district could choose to go further and put in place additional public health measures at the local level, as long as they're not doing anything that undermines or provides lesser protections as compared to the governor's executive order. So those are a few key points. One of the questions that we have been receiving, what did the executive order mean by covered workers having to meet the vaccination requirement? It's a very broad definition. So it's not just teachers, very broad, includes in the schools, all of our full and part-time staff, which includes our administrators, teachers, educational support professionals, includes individuals providing food, custodial, administrative support services, includes substitute teachers, whether they're employed by a school district or a vendor. It includes those who are working for other contractors and providers if they are individuals who are making regular visits into the school. And it even would include individuals who are regularly volunteering in the school. It does not cover somebody who's coming in to provide a one-time or limited duration repair service or construction. So it's important to understand how broad the executive order defines who we mean by the covered workers. We have, of course, layered on this the mask mandate for New Jersey schools that the governor announced way back on August 6th. That took effect immediately at that time. And we should be used, frankly, to the mask mandate. We had it for the prior school year, and we had a set of narrow exceptions to that mandate that have remained. So the same exceptions that we had previously, we still have under the new law. And that includes when a student's documented medical condition or disability, as reflected in the student's IEP or educational plan pursuant to Section 504, precludes the use of a face covering. So these are intended to be very narrow exceptions to that mask mandate. One of the exceptions is for extreme heat. The state of New Jersey did not put in place a uniform standard for defining extreme heat. So it's very important that school districts clarify this issue at the local level. What is your standard for when this exception would be invoked? And we know that certainly at the start of a school year, we will have potentially some of those days where there is extreme heat. We also know that not all buildings are created equal, and some will have air conditioning, others will not. Some will have very hot portions of a building that are much hotter than other portions of that building. So an exception here doesn't have to be the entire district, doesn't even have to necessarily be the entire school. We also know that sometimes on a school bus, it can get incredibly hot, and the district might need to invoke this heat exception there. So it's very important when you do this to develop a clear standard, to have protocols for how you're going to communicate that so there's no confusion on any particular day. And staff know, students understand, parents understand when this applies. So Dr. Yankas, I know districts struggle with this because we don't have a uniform statewide definition for this.
Right. I think this is common sense. And as you've said, David, I think you need a protocol to start with and stick with it. and get your faculty on board. Because if you have different faculty who perceive heat differently, you will have kids in some classes wearing masks and others not. Clearly, what we're also asking building managers is to take a good look. If you have rooms that are consistently unventilated or without windows, they shouldn't be used. Every time we allow an exemption to masks, we allow the virus to circulate. And every time we allow the virus to circulate, because it is airborne, we are then allowing people to get sick, and we're allowing faculty then to be absent. So it is in everybody's best interest to be very clear that extreme is part of this, not just hot, but extreme heat. And I would venture to say this is really up to principals of buildings and their facilities managers to take a good look at everything and see what could be used, what couldn't be used to avoid unmasking.
Absolutely. Now, we also, of course, Rebecca, was there a question?
Yeah, two quick ones. We don't want to get you
Please.
tied down here. Board of Ed members, are they considered somebody covered workers because they do visit the buildings frequently? They have meetings, they do things in the schools.
To the extent that they are regularly coming into the building, they could meet that definition. So you do want to be aware of that. I don't think that the statute was intended to mandate that board members be vaccinated, but sometimes board members are very regularly coming into the building, and the better approach might be to rethink, is that really necessary for board members to be coming in on such a regular basis into each of our buildings?
And the next quick one was, does the governor's executive order need an end date because it wasn't through the state legislature and it's not considered a state of emergency?
Even though we're not in a state of emergency, the legislature very specifically still granted the authority for the governor to do this while conditions require it. The legislation granting this authority to the governor did not specify that there has to be an end date. It really would be impossible to do that because conditions, we know, can change so quickly. So the governor is within his authority under existing state law to have put this requirement into place.
Okay, and one more last one, which we're going to come to, but it's popping up a number of times. The punishment for those who are not fully vaccinated, whether it's a state punishment or how that's going to work. But I know you're covering that later, so that's up to you.
Yeah, so I'll briefly mention that now. Individuals who refuse to comply with a mask mandate, if they're a staff member in that building, or they refuse to comply with either the vaccination or testing mandate, would be subject to discipline, and that certainly would likely be progressive discipline. But as a school district, you'd want to take very strong measures to make sure that you don't have a continual exposure of others from somebody who is refusing, for example, to wear a mask in that building. So immediate steps could be taken where that person in an extreme situation could be suspended. School districts are required, if you're, for example, dealing with a tenured school employee, to continue to pay that individual if we get to that situation where there has to be a suspension and the employee has specific due process rights that would have to be honored. So if you were, for example, dealing with a tenured employee and the person continuously refused to be vaccinated or tested or wear a mask, theoretically, that person would be subjected to tenure charges. And there would be a process the district would have to follow to do that. But yes, the individual could be subject to a very severe disciplinary action.
Thank you.
So a few things to think about with mask refusal, and I hope this doesn't happen in your districts. We don't want to get drawn into arguments over masking in the moment. So getting drawn into an argument with a parent, with a student, even with another staff member, is rarely going to be productive, could escalate, could lead to other problems. If you are a supervisor, you clearly have authority to enforce this requirement, to engage in progressive supervision, but you don't want to be drawn into a situation where perhaps you say something in a moment of anger that could be used against you. You do want to be prepared to address mask refusal in certain specific situations. One of the more complicated and predictable, unfortunately, will be students on buses. So you will need a district protocol, for example, for a student who refuses to put on a mask prior to getting on the bus, and for students taking off masks once they are on the bus. And that protocol may depend on whether the parent is present at the bus stop and the age of the student. So if you have a student refusing to wear a mask and there is a parent or guardian who is present right then and there, your district protocol could say that we're not going to allow that student on the bus. If you have a very young student, there's no parent present, and the student is unwilling to put on a mask, a bus driver would not be driving away and leaving a first grader unattended at that spot. So it's important that school districts think through that protocol. At a minimum, the school bus driver will need to immediately contact school district officials and inform them that there is a student or multiple students who are not wearing a mask on that bus. And school administrators should know that before any students exit that bus, so that immediate steps can be taken to isolate that student and not have them simply moving about the school and potentially causing a larger public health concern for the entire school. So you want to be prepared for that, and you don't want to be thinking that through in the middle of a situation. That protocol should be put in place now. We also know that you could have a situation where a student, after getting into the school, decides to take off a mask and not wear it, and districts need a protocol for that. And part of it would be just offering the student a mask. And sometimes it was the parent who said the child can't wear a mask, but the student will take one and wear it when you provide it to them. If that's not successful, your protocol could be to quickly isolate that student from others so they're not potentially compromising the health of others, to immediately contact a parent or guardian to come retrieve that child, and to effectively treat that child the way you would another child who needs to be quarantined while you're waiting for a parent to come. So Dr. Yankas, this is a critical health issue. If students are allowed to not wear masks, that can undermine all of our other efforts.
Right. In brief, I think we have to remember that masks, distancing, and hand washing have been the most important parts of keeping people well in schools or in corporate activity. And we also have to remember that in terms of wearing a mask and not wearing a mask, there should be virtually no reason for someone not to wear a mask at school. And when we look at what we've always learned is we have to be reasonable about what is feasible. But public health always supersedes personal privacy and personal rights.
Yeah, that's a great point, and it's a nice lead in to the challenges we have with letters that school districts will sometimes receive from doctors or other medical professionals. So a basic point, if a school official is provided a letter that appears to be from a doctor and it's directed to the school, FERPA, the Family Educational Rights and Privacy Act, would apply. There would not be any HIPAA concern with the school nurse or a school physician following up with the doctor directly to seek clarification regarding that note. Sometimes you'll have a letter that is written to whom it may concern. That's not technically directed to the school. In that case, school officials could say to the parent, we're not going to consider accepting this note and granting any exemption unless you provide authority for us to follow up and have a discussion with that medical professional and seek clarification first. And school officials have that right or could deny that request for an exemption. And we know that many notes are very vague and open-ended and need clarification. FERPA, there's a Q&A the U.S. Department of Education has put out on the issue of doctor's notes that clarifies that under FERPA, schools have a right to follow up, to verify the authenticity of the note, to clarify what is being said in that particular note, and that is not a violation of FERPA. So, Dr. Yankas, here's a few questions that districts should probably consider when they're thinking about doctor's notes and medical exemptions. And the first being, did it come from somebody who's even qualified to write such a note?
Right. Let's remember that we can accept notes from chiropractors when it comes to related to back or muscle injury. We can take notes from podiatrists when it relates to feet and orthotics. But when you're writing a note for an exemption during a pandemic related to a respiratory illness, it has to be from an MD or DO, physician's assistant, or an advanced practice nurse. We also have to recognize that the professional and most of these notes are on prescription pads. They're not letters. So we have to remember that there's no to whom it may concern or whatever. It just says Johnny Jones shouldn't wear a mask because of asthma, because of sensory deprivation, because of whatever. Often, most of the time in my professional experience is the doctor never wrote the note. Somebody in the front office wrote the note, the secretary wrote the note, a nurse wrote the note, but it was not the doctor. Again, remember doctor's notes are a request. This is not a mandate to the school. As principals and superintendents, you are in charge of what happens in your buildings. The doctor is making a recommendation for the health of this student. You have the right to accept it or not. And if there's any question, it should either go to your special needs people or it should go to your school physician to clarify whether this is legit. For instance, if a physician writes, if Johnny eats a peanut and has, shortness of breath, please give him an EpiPen, that is an order any school physician would certainly take. But most of the mask mandates, almost all, when you look back to the governor's order that masks should be dangerous to wear, and that's the exemption, there is almost no reason that it should be dangerous to a child.
That's a great point. So certainly in some situations, if we're talking about a situation that is a longer term, more permanent health condition, school districts, and one rule of thumb you could look at is whether this is a condition that is permanent or expected to last 6 months or longer. Then a district should look at a more formal process that we would use for a Section 504 plan. And you do want to clarify, is this situation a temporary or a permanent issue? And is the medical professional aware of alternatives that you have to a full exemption? So the medical professional might think that there are no mask breaks, that the student is for 6 hours straight wearing a mask and not having any opportunity at all. And if you clarify that's not true, that might change the recommendation coming from that medical professional.
A brief story is simply, I had a child in one of my systems who couldn't wear a mask theoretically. And a lot of it just turned around to the fact that it was the mask. She got a little kitten mask that she put on, and with mask breaks and the like, she wore it through her entire physical exam and the remainder of the school year. So you have to be creative and inventive. Children generally don't reject the masks. The parents do.
That's a great point. And even if it's a student with a disability, there are some key questions that we should be asking. So we want to be very clear what particular aspect of that student's disability prevents the student from wearing a mask. The vast majority of students with disabilities are absolutely able to wear a mask. So just having a disability doesn't tell you anything about the student's ability to not wear a mask. Is the student capable of developing mask wearing skills over time if they perhaps have a behavioral issue and it's difficult right now today for the student to comply fully with that requirement? So Dr. Yankas, I know you have worked with school districts on this issue, that you look to develop a plan to help the student develop those skills over time.
Right, and this is where your special needs and special services people come into play. It's really putting together a plan. We're not saying we're taping the mask to your face. We're also not saying you have total exemption. What we're saying to the physician that wrote the note or to the parent is, we will work with you to try to get this child to wear a mask, but as long as they are in school, they cannot present a risk to the rest of the class and the faculty. My greatest fear as a pediatrician for schools is there is that kid who tomorrow will be diagnosed with leukemia that we didn't know about today. And so that could be disastrous. The same is true for the faculty. So we are really trying to not make mask exemptions under any circumstances, but working with IEPs, 504s, working with special needs for those kids who are incapable theoretically of wearing it. It's amazing how much they can learn and do.
And it is appropriate for school officials to consider the health and safety of everyone else in that environment. So, for example, if a student has major behavioral issues and is unable to comply with social distancing and perhaps even has more extreme behavioral issues and is prone to engaging in violent behavior towards other students, in the middle of a pandemic, those behaviors become much more serious and certainly should be considered when we're determining whether that student is capable of being in school while protecting the health and safety of others. So these are complicated questions, but you do want to look at those other factors, and you do need to consider the health and safety of everyone in that environment. Of course, another complex issue that we've touched on briefly already is the governor's order for employees to either be fully vaccinated or subject to regular testing. One question that comes up with this: do parents have a right to know whether that teacher or other school employee is vaccinated? And the answer to that is no. We do have a legal obligation to protect the confidentiality of school employees' health information. So, and a parent would not have a right to know that employee's vaccination status. A parent would have a right to know more broadly what percentage of staff members are vaccinated. That wouldn't disclose anything about any particular staff member, wouldn't violate confidentiality. We at NJPSA did put out an article on the legal question of whether or not a vaccine mandate could be imposed, and there is clear legal precedent for this. There was a US Supreme Court case more than a century ago that clarified that we can have that type of a vaccination mandate. There is guidance from the EEOC that was initially put out in December of last year, updated in May of this year, that reiterates that school districts and states can impose such mandates. So we do give you some of that information. And Dr. Yankas, I'd ask if you could touch on some of the benefits of vaccination. For example, unvaccinated individuals, as you've noted, can potentially contribute to the spread of new variants.
Yeah, again, the virus will always seek an unvaccinated host for which there is a vaccine to prevent that. It is in any of our historic measles, polio outbreaks back in the time of scarlet fever and the like. One of the things that we've learned is if you can frustrate the bacteria or virus by immunizing or treating, then in fact, that's how you end the pandemic or the epidemic. We're hoping certainly for this to be the same thing. And again, unvaccinated people are more likely to be sicker. Unvaccinated people are more likely to spread this. And with the Delta variant, we are now likely to have an unvaccinated person spread this to 4.5 other people, whereas at the beginning of the pandemic 2 years ago, it might only spread to 2 people. So we're finding this is much more infectious. And again, it is much more infectious to young people who tend to be our newer teachers, our newer faculty, and tend certainly, obviously, to be our students. I would encourage schools, particularly high schools, to have their own vaccine sites for students who get parental consent or are over 18, and same for faculty. The other thing to consider is we did not have influenza last year really in New Jersey. We had fewer than 2,000 cases. It will come back this year. And remember, there has to be 2 weeks between your influenza vaccine and the end of your COVID vaccine. So if you are a unvaccinated teacher or student and you want to own up and get these done, you are looking at a timing that will not carry you well into October.
That's a great point. And as we have such a large number of students coming back for the first time, we're going to see those issues in a much greater depth than we had last year. We also know there was a CDC study that talked about unvaccinated individuals who previously had COVID, and those persons being more than twice as likely to contract COVID again as compared to vaccinated individuals who previously had COVID. So sometimes, Dr. Yankus, a person will think, well, I had the disease previously, I don't need this vaccine.
You're right. And again, this is still, COVID is SARS-CoV-2, and SARS stands for serious respiratory syndrome. So what we have to remember is if you've had a disease, the immunity may or may not last. We're learning that it lasts on average 3 to 6 months if you're unvaccinated. And so then you are subject to being ill again. We're not entirely clear why sick people who had the virus and didn't get vaccinated become sicker, but we do know that vaccinated people, the very few who become sick with the virus but are vaccinated, don't wind up in a hospital, don't wind up on a ventilator, and generally do very well. And people that are unvaccinated very often are the ones that have the long haul COVID syndrome, so with inflammatory disease. So it's important for us to do what we know so far, which is vaccination is helpful, vaccination is prevents disease. And at the moment, we know that for most people who are employed and working in school systems, this is our ticket out of having another pandemic year.
So of course, another part of our overall strategy is looking at testing. The New Jersey Department of Health and Department of Education did put out a broadcast email just yesterday on this issue, and we give you a link to that in this PowerPoint. In that memo, the departments detailed how to participate in the Department of Health K through 12 screening testing program. One piece to stress is that if districts wish to participate, you must complete the survey that was provided by September 13th. So it's a very short window of time at this point to make that decision. If you're interested in participating, there are a couple of different options for districts. The first, which I think will be very attractive for many districts, is to have access to testing resources through turnkey testing services provided on site by state contracted vendors in the north, central, and southern regions of the state. The second option would be for the local school district to be provided with funding to support a testing program that they are putting in place that aligns with Department of Health screening testing guidelines. And that program certainly can be used as a primary way to do random screening for students and staff. It could be used to address the mandatory testing for unvaccinated employees as well. So Dr. Yankus, this could be one important piece of an overall strategy to not have issues become much larger than they need to be.
Right. The state Department of Health is really investing a great deal in testing, particularly especially for the unvaccinated as a way. But remember, with testing, the good news is it works and it will help us and it'll keep pods and different kinds of classes healthy. But on the other hand, it's not as effective as the vaccine.
Mm-hmm.
In other words, if you get tested on a Monday, it doesn't mean you won't be positive on a Wednesday. You may have just simply been tested too soon. We know, and we also know with any testing, it's only as good as the sample you get. So if you didn't go up the nose far enough, if you did saliva, but it wasn't the right, so, testing is fraught with sometimes problems. I'm sure the private agencies that are contracted by the state, the vendors, are good at doing it. But on the other hand, you also have the issue of parental consent. And then what do you do with the unvaccinated non-consenters? Now you have them available to spread the virus in the school. So again, going back to vaccine clinics and encouraging vaccine among students and families is still our best bet to outwit the virus as it seeks to mutate again.
Absolutely. As far as when you might use screening testing, if that was part of your overall strategy, Department of Health talks about a few different pieces, depending on what risk level you are at. So at all risk levels for teachers and staff, screening testing of those who are not fully vaccinated, which has to be done at least once per week. So it could be done through this local option. For students, if we're in a time of low risk, screening for students might not be necessary, but once we get to that moderate, high, or very high risk, screening of students who are not fully vaccinated or random samples at least once per week could be a very good option. Dr. Yankas, to part on students involved in athletics, especially higher risk sports, I think is an important consideration for school districts because of the significant amount of contact involved there.
Yes, I mean, wrestling, basketball, some of the high contact sports, this makes perfect sense. The hard part for principals and superintendents and athletic directors is going to be to enforce and to affect it, because many of your coaches are not employees of your system. They're sort of vendors to your system. They're sometimes teaching in other school districts, but come to yours to do wrestling or basketball or whatever. So it's important that you have a protocol set up on how to deal with sports. And I have not seen yet the NJSA weigh in on this at all.
Absolutely. One thing I'll stress, even if somebody was working for you only as a coach and not as otherwise as a school district employee, they would still meet that definition of a covered worker. So that person would have to either be fully vaccinated or have regular testing. Contact tracing raises its own set of challenges, as we know, for school districts. So, keep in mind a close contact to somebody within 6 feet of another person with suspected or known COVID-19 for 15 or more minutes during a 24-hour period. Schools are required to assist, as we know, over this past year in identifying close contacts within the school and communicating that information to the local health department, and then are responsible for notifying parents and staff of the close contact exposure and exclusion requirements, but they have to do it while also maintaining confidentiality. So you should all know this, I believe, but it's important to stress that when you're sending out a note that somebody was a close contact, you're not sharing the name of the individual student or staff member who had COVID. So Dr. Yankas, that's an important piece of this, that we maintain that confidentiality.
Right, it's important that we do that. That's pretty clear. Certainly the network of mothers and PTAs and the like often know who it is, but the bottom line is it's not our job to do that. And again, it's a very important part of putting a halt to the spread of the virus within a class, a pod, or a school.
And one of the challenges we will have, you alluded to this earlier, Dr. Yankas, we are going to have a much larger cold and flu season, we expect. So that means we're going to have a larger number of individuals with symptoms that also look like COVID symptoms. And because of that, and with just a larger number of students in total in our buildings, we might need additional spaces for those who are showing COVID compatible symptoms. So that's a challenge for districts, Dr. Yankas, to make sure that we've got these appropriate spaces beyond just one room.
Right, and in many of those one-room spaces disappeared over the summer because schools wanted to take them back for instruction or storage or whatever else. And we also have to recognize we're having a lot of school nurses who are coming to work who have never done this before, because there is a shortage of school nurses who are school nurse certified, no less. There will be open positions. In my county, there are 14 open positions alone. So yes, quarantine space will be at a premium. There should be spaces. And we have to remember that also this year, unlike last year, nobody's taking temperatures when they come to school and nobody is screening. There is a general Department of Education note that went out in the Return to School 21-22 that talks about screening, but it's up to the parents. There isn't daily notices going out with you responding it is up to the parent to say, well, they've got vomiting and a fever, they have a cough and a whatever, so I should probably get them tested. Doctor's offices will, when in doubt, always test for COVID.
Absolutely.
But I think the important thing is quarantine is still going to be an issue, and it's meant to separate the sick from spreading disease in the building.
Now, we do have certain individuals who would not have to quarantine. So, for example, if you're a close contact, but you yourself are fully vaccinated and you're showing no symptoms, you would not have to quarantine. And we do see another exception here that I just urge school districts to make sure you use with caution. So in the K through 12 indoor classroom setting, if you had two students who were close contacts who were within 3 to 6 feet of each other, and one exposed the other, if both students correctly and consistently wore well-fitting masks the entire time, we would not have to have one of those individuals quarantined. But Dr. Yankus, that's an important caveat, is that you'd have to be able to certify that both students were correctly wearing well-fitting masks the entire time.
I have to say, when I first saw this, when it came out on August 30th, it made no medical sense whatsoever to say that if you're a contact in class versus a contact outside, and what about sports? What about extracurricular activities? It really didn't say, because those things happen. What if you're on the volleyball team? Is that considered class? Is that not? But what exists at the moment as a directive is basically to say that where there are close contacts, they don't need to quarantine. Where the infected student and the exposed student wore masks, the burden then is on the teacher, and I accent burden, and the nurse, but principally the room instruction person, the teacher, to be sure that the mask was correctly worn, which is almost never the case.
Yeah.
So when in doubt, you're going to be quarantining.
Absolutely. I want to just underscore that. When in doubt, we should err on the side of quarantine. And I would be very reluctant, if I were a teacher in a classroom, to be able to certify that both students absolutely were wearing that mask correctly, consistently for the entire time, and not take that extra step. So we do give you here from the Department of Health the minimum quarantine timeframes. And they do vary depending on whether or not we're in a period of low or moderate risk, and whether or not the individual involved has a negative test result or not. The preferred time still is 14 days, but that is just a preferred time under CDC and state guidance. It is not a mandatory amount of time. The mandatory times for periods of high risk or very high risk would be 10 days without testing, and also for moderate risk, and shorter periods of time if you actually had a negative test result. So Dr. Yankus, it is important that we pay attention to what risk level we are in at any given moment to make sure we're following the right standard.
Right. 2 points to this. One is we have to remember New Jersey has been essentially in moderate risk almost always. There was a brief period where Cumberland and Mercer County were in low risk this year, but otherwise we have been between high risk and moderate risk all the time. And as I said before, Ocean and Monmouth County as of last week were in high risk. So the issue here is 14 days is still the preferred. So the second part of this becomes the local health department's interpretation, which is often different than school. For instance, you have a mother or father that tests positive. So they're in quarantine for whatever is feasible for them with and without testing. And then the question is, so the child is now a contact of that parent, and the child goes into quarantine, but for how long? Do they go into quarantine from the time of the illness, from the time of the positive test? And when does their 14 days start? My experience is that different health departments will interpret this differently. Some kids are just 14 days from the time their parents get sick, so they're like both quarantining at the same time. And in some cases, the interpretation is the 14 days starts for the child after the parent's 14 days is over. So the child is essentially out of school 28 days. So it can be different. And schools have to be prepared to teach that child for 28 days.
Absolutely. And we'll touch on that in just a moment in a little more detail. Before we go there, of course, one of the questions is about quarantine of employees. At NJPSA, we are concerned that some strong appropriate protections that were in place for a period of time during this pandemic were allowed to lapse in legislation. So at this point, employees may be charged for use of sick days when they are required to quarantine, even if that is through no fault of their own, the exposure that they had that requires that individual to quarantine. So a school district at the local level could work with local associations to not do this, but as a matter of state law, employees are subject to being charged for use of sick days during the quarantine. The employee also doesn't have a right to demand to work from home. The employer can consider that in some cases where feasible. But if you do go down that road, you do want to have very clear criteria for when and how you're going to allow for that, so that you're not inadvertently opening Pandora's box and subjecting yourself to charges that you are using some sort of favoritism to allow some employees to work from home and not others. So Rebecca, I know you're very sensitive to this as a HR director. You'd want to be very careful about allowing this option.
You have to be extremely careful because once you let one person work remotely, even if it's a legitimate reason, and usually it's content, you cannot find a substitute teacher to cover the content for the person who is going to be quarantining. And it's not fair for the students, especially in secondary schools, to suffer a loss of content. So let's say you try to say, okay, we will let this person work remotely. Well, then, of course, you do need still coverage in the classroom because the kids are still there. So now we're looking at two people covering for one person's absence. And more importantly, once this starts, then you get the people who come forward with childcare issues and all kinds of other issues that we've had for the past year and a half. So you have to be extremely careful, and it has to have its own set of reasons that are different from just giving somebody remote. It has to be somebody who is teaching a subject where you can't find a replacement. It has to be somebody who you can find coverage for the kids still sitting in the class, meaning cover them physically while the person's teaching them remotely. So, and then of course, in all honesty, you can't find either right now. There are no subs out there and there are no content people willing to come in for short-term leaves. Right now, people are in demand and they don't have to take a 2-week job. They're looking for full-time jobs. So it's a very interesting scenario. School districts are coping with extra period stipends. They're coping with very creative ways, but it is a challenge.
Yes. As far as travel and quarantine, so the official travel advisory was allowed to end in New Jersey, but we still have some clear criteria for travel and quarantine for those individuals who are unvaccinated. So for unvaccinated travelers, not only should that person be getting tested 1 to 3 days before a trip and 3 to 5 days after travel, they should also be staying home and self-quarantining for a full 7 days after travel if they have a post-travel test and that test is negative. And if they're not tested, they should be staying home and self-quarantining for 10 days after travel. If you have somebody who clinically recovered from COVID in the past 3 months, there would not be a requirement to quarantine. If you're a fully vaccinated traveler, there would not be a requirement to quarantine, but there is this recommendation for testing 3 to 5 days after returning to the US. So the travel piece can raise a huge issue for school districts. Once schools know that an employee traveled, so if you have an employee who travels over the Labor Day weekend and goes somewhere other than one of the immediately contiguous states, and that person is unvaccinated, you now have a duty of care because you know of the potential risk of exposure that that travel has created. And Rebecca, you say this all the time, once you know something, you know it. You can't pretend that you're unaware that this staff member now potentially could be risking others.
That's absolutely true. And in all honesty, we owe it to our staff, we owe it to our communities to follow this with equity and to follow these rules for everybody. We shouldn't be making, exceptions for one or not the other unless they follow the mandates that your district has set down. It's very hard to tell one person, oh, you went to Connecticut, you're close, don't worry about it, come on back in. And then somebody goes maybe one state up, down, or around there, and you say, oh, no, 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 you have to stay out, use your own sick days. I think that everything that we do on a daily basis with equity in terms of following rules has to transfer over to all of these scenarios or districts, and in particular, putting the safety, as Dr. Yankees and you always say, putting the safety of our kids and staff members in jeopardy if we don't.
That's right. So Dr. Yankees, this is a very serious issue, of course, for families as well who will decide to travel despite these criteria.
I think this is the slide that principals and superintendents should be sending out today before school opens, so families know before the school starts, because they may want to revise their travel. The CDC has recommended that if you're unvaccinated, you don't travel. And the other thing we have to remember is when you look at New York, New Jersey, and Connecticut's infectivity numbers, we're almost triple the other two states. So we're more dangerous than Connecticut and New York. So
Yes.
as a consequence, more states are going to be worried about people traveling from us to them. But I think this is information that should go out, not day one of school, but before people make a choice as to what they want to do for the weekend.
Of course, where we do have students who have to quarantine, the Department of Education did send out a memo on August 11th that talked about, in a way, complimenting you for your immense creativity and innovation at the local level in delivering high quality education, but indicating that the department expects you to continue to do that. So what does that mean? The department is laying out an expectation of continuing to provide virtual instruction for students who have to quarantine. And they were a little bit more specific in the road forward, saying that school districts should be prepared to offer virtual or remote instruction to quarantine students in a manner commensurate with in-person instruction to the extent possible. So as a school leader, you do want to try to level set expectations here. I know how incredibly difficult it is to have students who are physically in class and other students who are participating virtually. The state of New Jersey has indicated that they expect districts to make every effort to do that when students have to quarantine. So it's important for school districts to have staff understand this could happen. And if it happens, it won't happen uniformly across the board. So there could be some additional burdens on some individual classes or schools or in particular teachers that we need to be ready for and do the best we can to support those staff when we have to provide that virtual instruction. Food in schools, of course, also raises incredibly challenging issues. If to the extent that we have students who are eating in a cafeteria, of course, they're not going to be able to keep their mask on while they're eating. The department has said you should make every effort to maximize physical distancing, given the fact that students will not be able to have a mask on while they're eating. So that should be a critical part of your planning. Some school districts are looking at areas beyond the cafeteria to help with physical distancing. The department has indicated the importance of maintaining cohorts and limiting the mixing of students so that if you do run into a contact tracing situation, you're not having to potentially deal with everyone in a large cafeteria. You have a much more controlled small group of students who stay together. Of course, discouraging meal sharing, encouraging routine cleaning between groups. As we said, many districts looking to go beyond the cafeteria and use other spaces. One issue I do want districts to be sensitive to, if you're going beyond the normal cafeteria, if you have a student with a disability who would like to, be out there on the school grounds and in a picnic-like setting with some of their friends, and that student is in a wheelchair or has some sort of disability that makes that very challenging, you want to think through how can we support that student so that they can have the same access to be with their peers as others. So these issues are difficult to resolve, but you do want to build it into your planning process so that we're not limiting the access of some students to an important part of the day, that opportunity to socialize with their friends. So of course, as we've gone through today's webinar, we've noted a number of issues that are raise foreseeable legal challenges, and planning for them is critical, even though even with planning, we know we'll still have some challenges. So there will be resistance to vaccination by some employees in the state of New Jersey. We expect that it will be a small percentage who actively refuse to comply with the new requirements. There will be resistance to mask requirements. Again, we hope by a small percentage of students and parents. But what you can't have is inconsistent enforcement. This is a part as school leaders that you have much more control over, and you've got to send a clear message that we need clear, consistent enforcement for students and staff. And parents need to understand that students will not be allowed to simply move about a building without a mask on, that there will be potential disciplinary consequences, and the student should be isolated from others. We do need to be prepared for other challenges like the loss of space for quarantine. And if we take the steps that we're talking about here, we will be doing our part to protect all of our students, protect all of our staff, and to make sure that you're doing everything you can to reduce any potential legal liability as well, as we're doing all that we can to support our students and have a really great reopening of schools. There are so many wonderful things to look forward to with the reopening of schools. And we know we're talking here about all of the challenges. We don't want to lose the excitement of a new school year. And for many of our students, we want to remember how excited they are to finally be back with their peers. Dr. Yankas, any final thoughts before we open it up for any final questions?
As I've always said during this, feasible, reasonable, be nimble and ready to pivot.
Rebecca, any final questions we have from participants?
Procedures on any of these things will save all of us aggravation. It will make it fair. It will protect our students, our families, our staff. Sit down with the Department of Health, with all the information you have, make a decision, let your lawyer look at it, make sure everything's fine, and then follow it with no variations. That's the way to get through a lot of this.
So I want to thank both of our wonderful guests today, Rebecca Gold and Dr. Yankas. I want to thank all of you who participated today. Please tell your colleagues that we will also make today's webinar available on our website at no cost. And we do want to share this information broadly with others. For all of those who participated today, you will also be receiving a recording of this. And you will have access to the PowerPoint as well. So we encourage you to turnkey this information. And thank you for all that you're doing. Be safe, be well, and we do look forward to seeing you all as we move forward into what we hope will be a wonderful and exciting new school year. So thank you, everybody.
Thank you.